Ever wondered what depression truly is? It's a question that often sparks curiosity and misunderstanding. Depression is not simply a fleeting feeling of sadness or a temporary reaction to life's struggles. It's a prevalent mental disorder, an insidious fog that can envelop one's life, making even the simplest tasks feel monumental. Depression is a complex condition characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It's a disorder that can impair one's ability to function at work, at school, or in relationships. It's important to remember that anyone can be affected by depression, regardless of age. From the bustling student to the retiree enjoying their golden years, depression does not discriminate. Depression is more than just feeling sad. It is a serious condition that requires understanding and medical attention. It's not something to be brushed off or ignored, but a real, tangible issue that needs addressing. Depression is not a sign of weakness or a character flaw. It's a real illness with real symptoms. Let's delve into what these symptoms actually are. Imagine waking up every morning with a heavy feeling in your chest. You're not just tired, you're drained. Even the simplest tasks feel like climbing a mountain. That's what persistent sadness feels like. A hallmark symptom of depression. It's not just about feeling blue, it's a relentless sense of despair that doesn't lift even on good days. Then there's the loss of interest in activities. Remember how you used to love painting, cooking, or even just going for a walk? With depression, that joy just vanishes. It's as if someone turned off the switch to your passions and you can't find the energy to turn it back on. The world seems colorless, tasteless, and joyless. Now, let's talk about changes in appetite. Some people with depression find themselves eating too much or too little. You might find comfort in food, or food might just lose its appeal. Either way, these changes can lead to significant weight loss or gain, adding another layer of concern. And then there's the difficulty sleeping. Imagine lying awake till the wee hours of the morning, staring at the ceiling, your mind a whirlwind of thoughts. Or perhaps you're sleeping too much, yet you still wake up feeling as tired as you were when you went to bed. Both scenarios are common in people battling depression. These symptoms are not fleeting. They persist day after day, week after week. They're not the kind of feelings that can be shrugged off or willed away. They're intense, they're enduring, and they're real. Depression is a complex condition affecting every aspect of a person's life. It's not just about feeling down, it's about feeling empty, disconnected, and hopeless. It's not just a bad day or two, it's a persistent feeling of emptiness and despair. Depression doesn't just affect the mind, but the body as well. It's like a shadow that follows you everywhere, casting a dark hue over your life. It's not simply about feeling sad or down in the dumps. It's a complex condition that can manifest in a variety of unexpected ways. One of these manifestations is physical pain. Surprisingly, depression can lead to a range of physical problems. Some people may experience constant back pain, headaches, and even digestive disorders. It's as if the emotional weight being carried around starts to take a physical toll. This is because our minds and bodies are intrinsically linked. When the mind is in distress, the body often follows suit. Depression also has a profound impact on daily life. It can make ordinary tasks seem extraordinarily difficult. Simple things like getting out of bed in the morning or even just making a cup of coffee can become Herculean tasks. It can feel like you're walking through a thick fog, unable to see the path ahead, and then there are the relationships. Depression can strain the bonds we share with our loved ones. It can make it hard to connect with others, to express how you're feeling, or even to feel at all. It can create a sense of isolation, even when you're surrounded by people who care about you. But here's the thing about depression. It's not a sign of weakness, and it's not something to be ashamed of. It's a medical condition, just like diabetes or heart disease. And just like these conditions, it can be managed with the right treatment and support. Depression can disrupt every aspect of your life, but there is help available. Remember, it's okay to ask for help. It's okay to reach out. You don't have to go through this alone. There are people who want to help, who can help. You're not alone in this fight. Remember that. Depression doesn't discriminate. It can affect people of all ages. From the youngest among us to the oldest, no one is immune to the shadow of depression. It's a common misconception that this mental health disorder is strictly an adult concern. But the reality paints a different picture. In children, depression often manifests as irritability, rather than the typical sadness we usually associate with this condition. It's not uncommon for a depressed child to struggle with maintaining attention in school or to lose interest in activities they once enjoyed. They might also experience changes in appetite and sleep patterns. As we move into adolescence, depression often takes on a more recognizable form. Teenagers may experience feelings of worthlessness or guilt, and might even express thoughts of death or suicide. It's a troubling time when the hormonal changes of puberty intersect with increasing social pressures, creating a perfect storm for mental health challenges. In adults, depression can be triggered by a variety of life stressors. Job loss, relationship problems, financial stress, or the loss of a loved one can all contribute to the onset of this condition. Adults may also experience physical symptoms, such as unexplained aches and pains, in addition to the emotional turmoil. Finally, let's talk about our elders. Depression is not a normal part of aging, but older adults are at an increased risk. They may face unique challenges like the loss of independence or the death of peers. It's also worth noting that depression in the elderly can often go undiagnosed, as symptoms can be mistakenly attributed to other age-related conditions or overlooked entirely. Depression doesn't choose its victims based on their age, their social standing, or their achievements. It's a universal enemy, one that we must all be prepared to confront. But remember, regardless of your age, you don't have to suffer in silence. There are resources and treatments available. Depression may seem overwhelming, but help is out there. When depression casts its shadow, it's crucial to remember that you're not alone and there are steps you can take to find help. One of the first and most important steps is reaching out to health professionals. This could be your primary care physician, a psychiatrist, or a psychologist. These professionals are equipped to provide the help you need, and talking to them about what you're experiencing is the first step towards healing. Getting a proper diagnosis is also critical. Depression isn't a one-size-fits-all condition. It comes in many forms, from major depressive disorder and persistent depressive disorder to postpartum depression and seasonal affective disorder. Each type has its own set of symptoms, and understanding the specific type of depression you're dealing with can guide your treatment and recovery. Now let's delve into treatment options. There is no single right treatment for depression. What works for one person may not work for another, and it often takes a bit of trial and error to find the right fit. But rest assured, there are many options available. Psychotherapy, often referred to as talking therapy, is a common method. This includes cognitive behavioral therapy, which helps you understand and change thought patterns leading to negative feelings, and interpersonal therapy, which focuses on improving your relationships to enhance your mood. Medication is another option. Antidepressants can help regulate mood, sleep, appetite, and concentration. It's important to remember that these medications can take time to take effect, so patience is key. For some, a combination of medication and psychotherapy works best. Others might find additional benefit in lifestyle changes, like regular exercise, a healthy diet, adequate sleep, and avoiding alcohol and caffeine. Remember, each person's journey with depression is unique. The path to recovery may not be linear, and that's okay. It's about progress, not perfection. Above all, never hesitate to seek help. There's a whole community of professionals and fellow patients who understand what you're going through and are ready to lend a hand. Remember, it's okay to ask for help. You're not alone. Depression is a serious condition, but with understanding and the right help, it can be managed. In this journey of knowledge, we've unpacked the layers of this complex mental health condition. We've delved into its impact, how it doesn't discriminate by age, and the crucial steps to seeking help. Recognizing the symptoms is the first step towards recovery. It's essential to remember that depression isn't just about feeling sad or blue, it's a persistent feeling of despair that can affect every aspect of life. But there's hope. With the right treatment, be it therapy, medication, or both, symptoms can be managed effectively. Remember, it's okay to reach out, to ask for help. It's okay to lean on others when you're feeling low. You're not alone in this fight. Depression is not a life sentence. With help and support, you can overcome it. Don't hesitate to seek help if you or someone you know is suffering.